Okay, I want to welcome everyone tonight. It is 7 p.m. Pacific Standard Time here on the West Coast. I am Yolanda Frazier. I am currently chair and have been for the past 2 years of our local NAACP Chapter 1139B here in Vancouver, Washington. I am WIN chair, and for those of you who aren't familiar with that acronym, WIN stands for Women in the NAACP. And I would say during my tenure, I have produced and directed and co-directed various webinars amidst pandemic and the whole George Floyd social injustice. And I will tell you that it has been just a blessing to be able to come to you guys and share in loving our community and sharing loving one another. And during these Zooms, I try to bring to you, well, our WIN chair, try to bring to you topics of interest, topics that directly affect and impact our most marginalized, our most disenfranchised communities. So this health equity webinar is really a long time coming. And I was blessed to be introduced to Dr. Lisa Thompson. She is with AmeriGroup, and we are going to have a wonderful time discussing all of the health inequities and how can we bring health equity to myself, yourself, and all of your families and friends. So with that, I'd also like to start each of my webinars by first giving an honor to God and to my two beautiful late parents, as well as to my husband and our 4 children and everyone who has supported me in this journey. And with that, Dr. Lisa, again, I'm just over the moon that you are here today and you're going to grace us with your wisdom and your expertise in helping us understand what are these health inequities and why is it amidst our communities? It's prevalent since America has existed. We were designed to have, unfortunately, inequities and disparities. So Dr. Lisa, if you could be so kind to introduce yourself, I'm gonna hand the mic over to you.
Thank you so much. It's a pleasure to be here. It's a really wonderful opportunity to talk with someone who shares the passion that I have about health equity and about health, Black women's health especially. I'm a board certified emergency physician. I'm also board certified in hospice and palliative medicine. I had a clinical career for more than 20 years. I also practiced telehealth during that time. And for the past 6 years, I have served as the medical director for Anthem Nevada Medicaid. So that means that I basically help provide healthcare or make sure there's access to healthcare for about 250,000 lives in Nevada. And a fun fact, even though I work for the Nevada Medicaid plan, I actually live in New York City.
Look at that. That is beautiful. Oh my gosh. So you guys are in a treat. You see that she's very well credentialed, very well versed in the medical industry. And I should tell you that I'm also a health equity director as well as a DI director. And so what I bring to the table is also lived experiences, but also a wealth of knowledge of just that outreach that we need, that liaison to our communities. And so with that, Dr. Lisa, she did a beautiful job in creating this presentation. And I'm going to say this again, you all should feel very blessed. We are hearing from a doctor who's not only very highly credentialed, but she's of African-American diaspora. And no one can speak to me about my health unless it's someone who I trust and respect. And that goes also to representation. And a plethora of studies have shown that when we are facing our adversities or when we're trying to navigate certain paths in our life, when we have a representation of someone who looks like us, that can make a world of a difference. So, again, please welcome Dr. Lisa. It is a blessing to have you here. And thank you so much again for welcoming my invite to have you come join us tonight.
Well, thanks for making the invite. It's truly a pleasure to be here. This is a fantastic opportunity. I guess we should probably go ahead and start diving right in to our
Yes.
discussion. And one of the things I wanted to lead off with is the fact that Black women are affected disproportionately by certain health conditions. And there are a variety of reasons why we're more predisposed to certain health conditions, but I wanted to kind of give people an overview of the top ranking things that tend to affect us most often. As you can see, the first thing is heart disease. Number two is cancer. And I really want to kind of dive into some more discussion about breast cancer, especially. Number three is stroke. And number four is diabetes. The important thing to realize about these conditions is they're sort of connected in that there are similar risk factors, ones that we can control and ones that we can't control for these conditions, but they are interconnected. Um, and like I mentioned, they affect Black women disproportionately. The next slide shows you that Black people have the highest prevalence of type 2 diabetes and obesity. And both of those are huge risk factors for all of those conditions that I just showed you, for cancer, for cardiovascular disease, for stroke, and also for kidney disease. So it's really important to understand those connections, and even more important to understand the risk factors that we
Mm,
face. Now, there are certain things that put us at risk for these conditions that we can't control. Being a woman, for one thing, predisposes us especially to breast cancer and to certain other conditions. Our race and ethnicity, that's obviously something we can't control. Our genetics and our family history and our age. I think the genetics and the family history is a really important risk factor to pay a little attention to, because I know sometimes people are reluctant to share their medical conditions with their family and share their medical history with their families. They want to keep that to themselves. They feel like, that's my business. But I think we need to be more aware of what conditions run through our families, because one of the things that I'm going to be saying over and over again in our discussion is knowledge is power. And if you
mm,
know that a certain condition runs in your family and you're predisposed to certain things, you can tell your doctor that. And that can be very helpful when being screened for different conditions or trying to treat different conditions. So it's important that we share our medical history with our family. Now, there are several risk factors that we can control, which can in turn decrease our risk for not just breast cancer, but those other conditions that I pointed out at the beginning. One of those is the amount of alcohol we drink. They've shown that women that have more than two alcoholic drinks per day have a higher risk of getting breast cancer. Also, being overweight is a risk factor, not just for breast cancer, but for other types of cancer, for diabetes, for high blood pressure, for cardiovascular disease. Um, and, what goes hand in hand with that is physical inactivity. We're especially predisposed to being uh, to not moving these days, because most of us are sitting in front of a computer screen doing our work. So it's really important to figure out how we can get up and start moving around. It's not just, a nice thing to do. It's a life-saving thing to do when you look at all of these risk factors and these conditions. And then finally, our diet. there are certain foods that can help lower our risk of getting cancer and certain other
Mm,
medical conditions. And, those are the things that we all grew up hearing about, like the green leafy vegetables, fruits, trying to get foods that are all colors of the rainbow into our diet and staying away from the highly processed foods. So, these are things that we really need to keep in mind when we're talking about our overall health, uh, because, like I said, they all go hand in hand, and those risk factors uh, affect our predisposition to a variety of conditions.
I love that you created this so that people can have a realistic view of things that are not in our control and things that are in our control. One of the things that came to mind for me that I would think that would be placed on this right hand side on the green list is sleep. Sleep is so underrated.
That's very
And
true.
so, yeah, I mean, because, well, I've told you, I try to work out all the time. We try and eat healthy. All of our kids are athletes. But if I don't get a certain amount of hours of sleep at night, I can't even begin to do all those things on the right, on the green side. So, with a good deal amount or an adequate amount of sleep, puts me in that right thinking frame. Would you agree, doctor? And
Absolutely.
helping to choose what am I going to eat? Because if I'm sluggish, I may go through a drive-through, and I love drive-through. Everyone, I love,
Right.
love, love drive-through food. But
Right.
but if I'm thinking with the Yolanda clear mind that God gave me, that I try, and represent for my children and my husband, I'm like, we're gonna cook at home. It may take longer, and it's going to be a family effort. But no, sleep definitely came to mind, and people don't know that if you don't get a lot of sleep, it can lead to, all of those disparities, those health issues that we have. So,
Absolutely. That's a great point. And you're absolutely right. There's definitely a connection between our perceptions of feeling stressed out and our sleep.
mm,
And it can be a vicious cycle. And that stress and that lack of restorative sleep can
yeah.
also amplify our tendency to gain weight,
Mm,
to turn to things like alcohol, to turn to the fast food and the other types of food,
right.
when we're trying to keep ourselves awake or soothe ourselves or all of those different things. So there's definitely a connection there.
Mm. Thank you so much.
Absolutely. So one of the questions that I have asked many times is, why don't Black women get mammograms? In the health plan that I serve, we found that the majority of women who are eligible for mammograms are not getting them. Like less
Mm,
than 20% of women who are eligible for mammograms are actually getting them. And there was a really interesting study that was published last year where they surveyed Black women and asked them this question exactly. And multiple themes came up, but it kind of fell into two main categories. And one of those was lack of access, and the other was fear. Now, when it
mm,
comes to lack of access, I think that there's one type, which is, clearly the barriers that you and I are going to get into a deeper discussion about. And that comes down to lack of transportation or lack of public transportation.
right.
There's a zip code in the area that my health plan serves where there's not a mammography center for more than a 10-mile radius. And
Wow.
on top of that, there are no bus lines that go
Wow.
from that zip code to where the closest mammography center is. So that's a real barrier. A lot of times people also have lack of access because they're uninsured or underinsured, and there's concern about the ability to pay for a test like that.
Mhm.
So there are a variety of those types of real barriers to accessing mammograms. But then I think some of the lack of access is self imposed. I think we as Black women have a tendency to put ourselves at the very bottom of our
Yes,
priority list. And
yes,
we do prioritize our family's health and our jobs and our careers and school
yes.
and all these other things. But when it comes to our own health care and especially maintenance and preventative health care, we put it way down at the bottom of the list.
Mm.
And I'm sure that's probably something that you can relate to yourself as a career person, a mom, with all
Yes,
kinds of responsibilities.
yes. Well, I just entered corporate America just a couple of years ago after leaving it for over 2 decades. Because as soon as I, became pregnant with our very first child, after first got married, of course, and then became pregnant, I told my husband, I go, because my mom stayed home with us, Dr. Lisa, I felt such a great need to be there for my family and my children. Like, these are the most important stakeholders.
Right.
This is the people that I'm willing, if I'm going to work hard, these people are the ones that I feel commissioned, right? To provide the best care. And you're absolutely right. Um, I will, everyone has, or maybe you don't, have access to your provider through your phone. But I will go through on my phone and make sure that my children, well, half of them they're young adults now, but I'll still make sure if they've scheduled their next dental, their next hygiene appointment, if they've scheduled their annual appointment. But I must say that I do stay on top of my doctor appointments because I am that person that can be described as that classic worry wart. So my doctor has actually had to tell me, Yolanda, you are fine. If you actually wanted to get pregnant again, now that I'm in my 50s, you actually, I mean, you could possibly do it. That is not my goal. But when it does come to making ourselves a last priority, a lot of women in our culture, in our communities, we do that because we feel that we need to be this superwoman, right, Dr. Lisa? You and I have held multiple conversations on this, and we're taught to be resilient and tough. And oh no, my pinky, oh I cut it, it'll be okay. I'll just, I'll get by. And we get to the back end of our list when we really need to be reversing that. Because if we're not taking care of ourselves in a very optimal way, we won't even be here for those that we're putting first. And
Exactly.
and so to me, some people may say, "Oh, that sounds selfish, Yolanda." Well, let's take the ish off of self and let's dub it as self-care. And the reason why I self-care is such a high priority is because what is a high priority are my family, my loved ones, my friends who I want to be here for. And so yeah, and it's sad because I think it has been generational that we've been taught, you do this for your family, you stay in there, you eat last, you make sure everyone has ate first,
Right.
and you eat the scraps or whatever. And to me, it's like, what are we teaching our children? What are we teaching the communities that we serve? And if we're being transparent and honest, if we're talking about health, we need to be communicating and having these dialogues about self-care. Is so important. When I interact with you, Dr. Lisa, I want to be in my most optimal care so that you can fully understand me if I come to you with a problem or a need. I can't be out of sorts. And the only way to do that is to maintain myself. And so we have to dismantle, that structural way of thinking, as we need to dismantle racism. I saw Bridget had something in the chats. There's a lot of dismantling we have to do, everybody. And so again, this is why I'm so glad you're here, Dr. Lisa. Um,
Absolutely.
Yeah,
Yes, that's so true. And it's just like I know this is cliche, but like they tell you on an airplane, you have to put your oxygen mask on first before you
there it
can
is.
help
There
anybody
it
else.
is.
So
Yeah,
we have to prioritize our own health and make sure that we're taking control of our health care and that we are on top of what's going on with our own bodies. We should be the
yeah.
experts.
We
Um,
and we have to be the advocates. And what you just
right.
said about the airplane and the whole aviation industry saying put on your oxygen mask first, think about it. You guys, wouldn't you want your doctors in their best health if you're going to undergo a surgery or a major something in the hospital? Wouldn't you want Dr. Lisa to be at her highest performing optimal level? You don't want a pilot who just took drugs or who was heavily intoxicated to fly your plane. So think of it that way. I charge each and every one of you to think of it that way. You want the doctor who you're seeing to be very accurate in his or her diagnosis or just their preventative care for you. So you really really have to be your first knowing advocates. And as a mom, I tell people, or when our kids were little, um, they're like, "Oh, so your kids learned how to do this early?" Yada, yada. I tell them we're our children's first teachers and we are their first advocates. So if they see us do it, we're passing down this generational wave of making just everything better for all of us. So,
Absolutely. So, the other category of that was brought out when Black women were surveyed about why they were hesitant to get their mammograms was fear.
mm,
Now, some of that fear is of the test itself. People are afraid that the test is going to be painful. And the test is uncomfortable, but it's not painful. The
right.
other thing, the other thing I tell people is that the technicians that are there doing those tests are highly skilled, highly
Yeah,
experienced
yeah.
folks. And their primary focus is to make sure that you are comfortable enough for them to get the very best pictures they can.
Mm,
They're not going to let you be in pain or uncomfortable. They're there to help you to get through the exam and get the very best pictures possible. So if you are having, problems during the exam, then you need to let the technician know and work with them and they'll make sure that you get through it. So that's one fear, but I think the even bigger fear that a lot of Black women carry is, what if they find something on me?
mm,
What if there's something wrong or abnormal?
mm,
And I think that we really have to kind of flip that narrative because
mhm.
the beautiful thing is we have these tools available to us and they are so advanced that they can detect an abnormality that is smaller than the size of a pea. And if
Wow.
you have an abnormality that is detected when it is that small and that early, your chances of treating it and eradicating it are super high.
Mm,
If you just walk around and think, well, I don't want to know if there's something going on, by the time it's detected, it's so big and so advanced that the probability of treating it and getting rid of it is much smaller. And that's part of the reason why Black women have such a higher mortality rate from breast cancer, because we have a
mm,
tendency to delay getting the screening. And by the time we get treatment, the cancer is already progressed and advanced,
wow.
and it's much harder to treat.
Mm,
So knowledge is power, like I was saying before. It's much better to know if there is something there and that it's been detected at the earliest, smallest phase possible than to walk
yes.
around in fear and unknowing, not knowing what's going on there.
Mm, I love it. Yeah. It's and then access too. I think and it's sad, but I think it's taboo that we don't discuss, getting mammograms as much as we could. There needs to be more outreach to CBOs, to community organizations. There's a lot the healthcare industry can be doing and
Mhm.
should be doing. There needs to be liaisons. There needs to be some other marketing piece around communicating the importance of getting mammograms. It's so funny. You'll see ads or you'll hear things about buckling up, wearing your seatbelt. You'll see things, I mean, all sorts of things. But I think for me, mammograms, and I'm not a very big social media person, but those who do follow social media, I think maybe that could be discussed on those different platforms. It needs to be information that's readily and easily accessible. And again, that goes back to health equity. How do we make sure we are reaching and serving the most disenfranchised, the most ostracized? I'm going to say that, Dr. Lisa. I
Mhm.
mean, communities who've been ostracized, you know, and people get their news, their information from a myriad of ways. But how do we reach everyone? And I see that as a task at hand, because it needs to be communicated more, you know.
Absolutely. Yeah. And we're going to get into that concept a little bit more because what you're starting to touch on is healthcare literacy. And that's definitely a
Mm,
disparity that we're going to talk about. So why don't we talk about what are the healthcare disparities? These are these are barriers that prevent us all from having optimal health.
mm,
And the idea of health equity is that no matter who you are, the color of your skin, where you live, how much money you make, how much education you have, what language you speak, if you have any disabilities, what your gender is, what your sexual orientation is, what your religion is, no matter any of that, we are all entitled to have the healthiest life possible.
preach it.
And so these barriers that are in our healthcare system that prevent us all from what we're entitled to, these are the things that we need to address, to
Hmm.
recognize, and figure out how can we combat those things. Um, and one of the first disparities is that comes to mind is where we live. Um,
Mm,
there are some neighborhoods, there are some zip codes where the people living there have a much higher life expectancy by years difference compared
mm,
to the neighboring zip codes. Why is that? Why is it that some neighborhoods have food deserts? We've all
wow.
heard that term where there are stores that just have processed foods. There's not access to fresh produce, or
Hmm.
if there is fresh produce, it's more expensive than the other foods.
Mm,
Um, why is it that some of us don't feel safe going out and taking a walk and exercising
there it is. Yeah.
because of where we live? Or it's
Hmm.
not safe for us to let our kids go outside and play.
Mm,
Uh, Sometimes we're segregated and isolated in our neighborhoods.
hmm.
There are a variety of things. There can be, a big difference in the infrastructure of certain zip codes or neighborhoods compared to others, where there is good public transportation so people can get to jobs and to school and to doctor's
Right.
appointments. So when we're talking about healthcare disparities, it goes well beyond just, having access to doctors and mammograms and labs and pharmacies and things like that. It's really talking about the way that we live and even where we live and how that affects us.
And all that, Dr. Lisa, has been system, systematically designed. It was,
Absolutely.
we were designed, our neighborhoods have been gentrified.
Hmm.
We've been redlined. And
Right.
so when we're in this system that doesn't allow for us to go walk at our son or daughter's high school track because it's not upkept, then we find ourselves saving money to buy a treadmill that we rarely use. Whereas in other more prominent communities, they feel free, like you said, They can walk around. There's no care in the world. Everything is community based and community oriented. And so everybody, the slide that she previously showed is a great depiction of very debilitating neighborhoods compared to neighborhoods who welcome Saturday markets, fresh fruit, art classes, yoga classes, um, anything you can think of. And so when we're talking about health equity and health inequities, you have to be mindful of that. And a perfect example is that I was born and raised in North and Northeast Portland. And when I lived there 1,000 years ago, it didn't look like what it looked like now. Now you can go down Mississippi, Killingsworth, I mean, Prescott, you name it, and it's very posh. People are having mimosas in the middle of the day. And what bothers me is that it's bittersweet. You know, Dr. Lisa, I'm like, wow, I wish my neighborhood was like this when I was growing up.
Mhm.
You know, but people were scared to be outside, you know, after a certain time of the night. And so it's interesting after the neighborhood has became gentrified and they pushed all of us out and raised the rent and everything up
Right.
and brought in these new business owners. And so now you see this plethora of culture where they too may be living from paycheck to paycheck. But I'll tell you this, they now feel free to ride their bikes, walk their dogs, go buy a fresh watermelon, no matter what time of the year it is, no matter what the season is.
Mhm.
And they're more apt to this, oh, what's a good word for it? Just this overall better way of living, you know.
Right.
And for me, it's yeah. Every time I go over there, I bring my family over there, and we'll meet people, and they'll say, "Oh, where are you guys from?" And I go, "I'm from here," and they're like, "Really?" And I'm like, "Yeah, yeah, I'm from here." And so it just, and now it, there's bike lanes everywhere. There's no room for cars. So
Right.
it's good that we're cutting off, you know, we're cutting down the use of, you know, people, you know, those type of motorists. But no, it's that slide that you showed previously is a perfect example of why there are health inequities and health disparities. And I think when people digest that, they begin to understand why where a lot of us are still oppressed. And so we
Right.
need to not marginalize that and push that to the side.
Mhm. Yeah, and what you're talking about speaks directly to the concept of placism. Placism
Mm,
is discrimination based on where you live, based on your geographic
wow.
location. And there
Wow.
are many ingredients within that, but one of the main ones is racism. There was a really interesting, fascinating study that came out earlier this year where two reporters reviewed loan applications, mortgage loan applications from
Mm,
2 million people from the year 2019. And they controlled for certain variables, including income, level of education, the neighborhood where people were looking for homes, and their amount of debt. And even though they controlled across the board for those variables where everyone that they looked at was the same on paper, they found that banks were still
wow.
80%,
Wow.
80% more likely to reject Black applicants who are trying to apply for mortgages, even though they were the same on paper with everyone else.
Redlining
So,
is still going on.
right. So and it's not just about those things that we were just talking about, quality of life things. It's about
Mhm.
quality of healthcare because
Mm,
certain zip codes have higher quality health systems and
wow.
facilities and better access to healthcare than others. And like I mentioned before, there are certain zip codes where the life expectancy is years different from the neighboring
Mm,
zip code. So this doesn't just affect our quality of life, it affects our health care. And a lot of people don't recognize that.
Mm,
Um, the other thing that is important about placism and about where we live in our neighborhoods is the fact that if we're living in an area where we're socially isolated, like I mentioned before, maybe we're segregated, maybe it's not safe to interact with your neighbors,
yeah,
maybe you just, it's just not safe to go out and about, and there's just not a sense of community. They have done studies that show that loneliness can have just as much of an impact on our health as things like smoking, obesity, and physical inactivity.
that's
It's
scary.
super scary and definitely
Wow.
something we take for granted. It
Mm,
they've shown that people that are socially isolated and lonely have a higher risk of premature death from all conditions. It doesn't matter what.
do you
And
think, Dr. Lisa, that that is true because God designed us? We were designed for community, to be socially connected. There's something that's going on cognitively in our brains. It's a beautiful thing, like when I see your face on the screen, or when I get a phone call from my sister, or if
right,
I go out to lunch with a friend that I haven't seen in umpteen years. There's something about that social interaction that clicks, or it, I don't know, reinvigorates me. And
absolutely.
it accesses every, I don't know, nerve or being in my body. And you know this by now, my faith is Christianity. So I heavily believe that we were created for community. We were created to be together, and we can't make it unless we are together. And that also reminds me of, there was a study that I had read some years ago where it said married couples live longer than a single person. Um, and so I don't know.
Yeah.
What, how do
I
you
I think it's just our biology. We're wired to be social creatures.
require?
And I think in addition to that, we need each other. If there's
Mhm.
anything that the pandemic showed us is
Oh
that
my
we are
God.
interconnected. What
Yes.
we do affects the people around us, whether even if we don't know each other, we are all interconnected. And
Mm.
I think it's really important also to realize that we have to look out for each other. So, when we have elderly neighbors and, no one's paying attention to if they're how they're doing, do they have food? Do they have heat in their house in the wintertime?
Mm.
Um, you know, no one's checking on them to make sure that they're okay. That's another, example of why it's important for us to take care of each other and look out for each other and realize that we are connected.
That's beautiful. I love it. And I'm always checking on my neighbors, and they're always checking on me. And it's important. We're a community.
Right. That's what it's about. It's about that sense of community. And in some places, it's really hard to build that. So we were talking a little bit earlier about healthcare literacy. And what that means, what healthcare literacy means is our ability to understand information and use that information to make decisions about our own health.
Mm,
So, a real simple, perfect example of what I mean by healthcare literacy is your ability to read and understand what's written on your prescription bottle. If you can't read it or if you can't understand what it says and you can't follow those instructions, that is going to affect your health outcomes.
mm,
And it's been shown that the majority of us in this country have low healthcare literacy or could even be called healthcare illiterate. And it has nothing to do with your level of education. In fact, they've shown that 50% of the people who are counted as healthcare illiterate in this country actually have a college education, and
Wow.
97% have a high school diploma. So it's not, it doesn't have anything to do with your level of education. I think that most of us are healthcare illiterate because our healthcare system is so complex and so complicated and so
Yeah.
fragmented.
Yes.
It's really difficult to navigate. It's really difficult to understand. We're intimidated by the system. It's huge, it's overwhelming. So we
Hmm.
don't ask questions when we don't understand. And all of that leads to poor health outcomes. People that have low healthcare literacy are more likely to go to the ER repeatedly. They're more likely to get admitted to the hospital repeatedly.
Mm.
They have poorer outcomes when they have a medical condition. So, we can look at breast cancer as an example of that. Not understanding the importance of getting a mammogram and, not understanding that you need to follow up after you get the test is what causes delays in getting treatment, which in turn causes people to have poor outcomes, poor prognosis, and a higher
Mm.
mortality. So that's just one example of how healthcare literacy is can be a disparity, and really is a disparity for most of us. But imagine how that's amplified if you're elderly or if you do have a lower education level. Um,
Right.
is even worse, than it might be for other people.
It's compounded.
Right. Exactly. So, we've been talking about all these different things, all these disparities, our broken healthcare system, our predisposition to getting certain medical problems, and it can feel like everything's stacked against us, and there's nothing we can do about it.
Mm.
But I want people to understand that, like I keep saying, knowledge is power, and we can do something about our own healthcare. I love this quote from Alice Walker. She said, "The most common way people give up their power is by thinking they don't have any." And I think that a lot of us feel that way about our healthcare and about, the medical system in general. And I want people to come away from our discussion today understanding that that's not the case. There are things that we can do. We can empower ourselves to take control of our healthcare. One of the things is to make sure that you take advantage of the screenings that are out there
Right.
to keep us healthy. And, if you do have something going on, like a cancer, that it's caught as early as possible so that it can be treated and you have better outcomes and a better prognosis. Like I mentioned before, some people don't have access to these screenings because they're uninsured or underinsured or worried about the cost. And I wanted people to be aware that if you feel like that's a challenge for you, that's one of the barriers for you getting your cancer screenings, there are programs where you can get your screenings covered. And that should not be a barrier for you to get your mammogram, your cervical cancer screening, your colorectal cancer screenings done. And I have the information here for folks living in the state of Washington. You can go to the Department of Health website, or you can call the phone number that's there, and they'll help you
Hmm.
figure out if you're eligible and then what you need to do to get those screenings done. These are powerful tools that are at our fingertips. Like I said, mammography has advanced to the point that it can detect an abnormality that's smaller than the size of a pea. We need to make sure that we are getting access to those tests because we're all entitled to have the best health possible, like I was saying.
Yes. And to know that it's free. It's
Right.
accessible.
It,
And a lot of
exactly.
times people don't know that.
Exactly. Exactly. And that
So
should not
thank
be
you
the
for
reason.
sharing that.
Right.
Yeah.
The other thing is we have to arm ourselves with information about our healthcare, about our bodies. And, a lot of times people go by hearsay. They look at stuff on social media. They,
Mm.
see random bits and pieces of information that is just not true and not accurate. So, I want people to start being more specific about where they're getting their healthcare information from. And one of the best sources of accurate healthcare information is the National Library of Medicine. And like
Mm.
I'm showing you here on this slide, all you have to do is go to the website, scroll down to where it says for the public, and then you've got these three amazing resources that you can click on and find out about anything you could possibly think to ask about healthcare. And even more importantly, if you look at the bottom of this screen that's popped out here where it says search for clinical trials, you can
Yeah.
find out what clinical trials are going on out there in the world for all medical conditions. And I want people to start paying attention to that and even participating in that because right now, the treatments that we have available to us for most medical conditions, they figured out those things by uh, studying men and especially white men.
Wow.
There are very few clinical trials where Black women have been the subjects of the trials, which means, that's another disparity for us. We're
Mhm.
not getting treatments and testing and things like that have been tailor made for us and for our genetics and
Right.
our makeup. So it's important for us to start participating in those trials, and it's also important for us to know about those trials when we do have a diagnosis of a certain medical condition, so that maybe our doctor isn't aware that there's a new thing that's being studied that might be
Mm.
beneficial for us. It doesn't hurt at all for us to arm ourselves with information and education about our health. Um, Another resource that I think is really useful is the CDC website. That's another source of very accurate, up to date health information about anything you could think of that you want to figure out when it comes to your health.
Right.
So yeah, the CDC website is a really good source of accurate, honest health information, and so is WebMD. And one of the reasons I
Mm.
like WebMD is because the information there is written in a way that is a little bit easier to understand and a little more accessible. But again, is accurate, uh, research-based, evidence-based information, and anything you could possibly think of that you want to know about medications, any health condition, any type of health question, you can
Mm.
find the answers there. So I highly recommend that people start going to these sources instead of, what I call Dr. Google, when they're wanting information about their healthcare, because unfortunately, Dr. Google can kind of send you on down a rabbit hole where you're
Yeah.
going to get exposed to information that's not evidence based, that's not accurate, and not true always.
And that's good
These
that
are
you
sources
provided
of
these.
truth.
Yeah, since people like to Google, these
Mhm.
are two websites you guys
There you
can
go.
Google.
Right.
Yes.
Right. Um, so like I said, I want people to empower themselves to take control of their healthcare. And part of that is not only looking up information and being knowledgeable about your healthcare and your health conditions, but really taking advantage of those moments when you do go see your doctor. People need to ask questions
Mm.
and not be afraid to ask questions when they don't understand something that their doctor's telling them. And, I think what happens to a lot of us is we forget what the doctor said to us during a visit, or we have questions and we forget to ask them. So I think it's really important to write down your questions And when you're in the doctor's office, to take notes about what he's
Yes.
telling you so that you can
Yes.
refer back to it later. Or another tool we all have right at our sides all the time is a phone. You can take notes in your phone, or you can even record the office visit. There's no rule that says that you can't do that, and then you can listen to it afterwards. Um, Sometimes it's helpful to take someone with you to your appointments, and that way they can help you remember what the doctor talked with you about and maybe remind you to ask the questions that you need to ask. Um, you need to make sure that you feel comfortable with your doctor. If your doctor is impatient and doesn't seem like he wants to answer your or she wants to answer your questions, uh, or you feel like you're not being heard when you bring up different problems or concerns, or you feel like you're rushed, it's important to go see a different doctor. We're all entitled to request a change of assignment. If our insurance plan assigns us to a primary care provider and we don't feel comfortable with that person, we are absolutely entitled to ask to see someone different. Or if you need to see a specialist and you don't feel comfortable with the first one, you're absolutely entitled to go to get another opinion from another specialist. The better thing to do is that what I was just describing. Shop around until you find the physician you feel comfortable talking with, and not to just stop going to the doctor. And I think that
Mm,
that's what happens to a lot of people. They have a
yes.
bad experience, they don't have a good connection with their provider, and so they just don't go. Um, the other really important thing is, I think for some people, it's important that their provider is culturally similar or culturally congruent. And there's nothing wrong with asking for that. If you want to see a Black female physician, you should ask for that. If you need a physician that speaks a certain language, you should ask for that. And if you have insurance, it's just a matter of reaching out to your insurance plan, and they can go through their directory and find that. Or there are lots of sources where you can search yourself, for the type of provider that you are going to feel most comfortable with.
Mm.
Um,
Talking
and
about empowering yourself. I love it.
Also, I think that we need to take advantage of all the resources that are available out there. Like the slide that I showed you where there are free cancer screenings
Hmm.
available.
Hmm.
Um, if you don't know that you are eligible for things like that, then you're missing out on, some really important resources. Sometimes our health plans also offer all types of member benefits that we're not even aware of. A lot of health plans cover gym memberships, and many people don't realize that. They will cover your visit to a dietitian or a nutritionist, or uh, a variety of different benefits that we just need to take the time and find out about, and then take advantage of those things. Um, because at the bottom line is, we are entitled to have the best health possible.
Yes,
And these are the ingredients to how we can achieve that.
that is awesome. Well, I truly hope everyone who's listening on this call now feels empowered, because we can sit there and we can talk and talk and talk about, the health inequities and the barriers and the
Right,
disparities that really do exist within our communities. And we don't know when all of that will be, eradicated. But the fact is we do have access to all of these resources. And hearing you, Dr. Lisa, reiterate that and validate that. I mean, it's coming from, as they say, the horse's mouth. Um, all of you guys should be truly empowered. And I like the part where you talked about a lot of people stop going because they don't like their doctor or they feel uncomfortable. And I
right.
also think people didn't know that they can actually record their visits. I mean, sometimes, and again, another one of our conversations, this came up between you and I, when people go to their doctor and if they're inundated with some negative news or even good news, they may forget the fine details. So
Mhm.
even taking a person with you or taking a notepad, but having it recorded, to me, that's golden, because
Absolutely.
your your significant other or your sister or your best friend who came with you may actually interpret what the provider or the doctor or the nurse or whoever it is said. And you two can go back and forth in the car. No, I thought they said this. No, I thought they said that. But
Hmm.
then if you have it recorded,
You can hear
I think
exactly what
it,
they
it
said.
empowers you. Yes. And you can go back to that recording. And what's really telling here is that um, our communities have been left out. Dr. Lisa, you know this. And the only way that we can truly um, make our communities thrive is to know that we have access to all of this.
Mhm.
And so I believe right now we're going to open it up for some questions. I'd like to call on Bridget. Um, Let me see, what time do we have? 7? Yep, we're almost at the top of the hour. Bridget had posted a question earlier. Melissa or Roy, can one of you guys find her question? Or Bridget, if you guys can unmute Bridget.
Oh, I see the question now, and I
Okay.
can read it to you. What part is racism playing in the disparities?
It's baked into every disparity you can think of. um, and we just barely touched the surface. We just barely scratched the
Yeah.
surface of the disparities. But yeah, that systemic racism, it really has deep roots in every disparity. Whether it's, social determinants of health, like having access to transportation and housing and food security and things like that, because that's something we didn't even really delve into. You can't really be uh, concerned about your mammogram or your diabetes screening or your blood pressure if you're worried about feeding your children and having a
Mm-hmm.
place to lay your head. um,
Mm-hmm.
so, and that all, if you, dig down uh, through those types of issues, there's systemic racism at the root. Um, if your level of education, your access to care, where you live, the placism we talked about, um, all of those disparities are, they have racism at the root.
Unfortunately.
Right.
Again, it's our infrastructure has been systemically designed to
Right.
keep us where we're at. And so when I bring up dismantling these structures, we have to be those role players so that
Mhm.
we help. And no matter what industry, what environment we're in, as Dr. Lisa just said, um, whether it's the healthcare industry, if you're in law enforcement, if you're in education, whatever role you play in and out of your community, you have to be the one to help dispel those discriminations. Um, and it's sad because I was listening to someone just recently talk about how medical schools are deliberately not letting people of color, specifically African Americans, complete their residencies within medical school. So while we're
Mm.
trying to actively search for a provider or doctor who represents us, they're now not passing them within medical schools. And
Hmm.
so it's happening right at the front door in a lot of areas and spaces that are unknown to all of us. And so when I talk about holding the door open or making sure that you're providing um, information and resources and opportunities to our most disenfranchised, I'm really honing in on bringing us to the table. And how do we do that? We do that by outreach. We do that with very informational webinars like tonight. And so knowing that there are disparities, that's one thing, but knowing that we can play a part to dispel those disparities, I think really helps to empower us. So
Absolutely.
Okay, we have a couple more questions in the chat. First, for those that work in healthcare, what can we do to help the disparity concerns within healthcare?
That's a great question. And I think part of it is that we have to do that outreach and that communication and that education, which
mhm.
I think Yolanda touched on earlier in our conversation. I think a really great example of that is when the COVID vaccine first came out.
Oh yeah,
How important was it to hear from providers of color, healthcare professionals of color who had received the vaccine and were, out there letting people know that it's safe. I've gotten it.
mhm.
It's okay. You should go ahead and get the vaccine. Um, that kind of outreach and communication, I think, is our responsibility in the healthcare system. Because a lot of the other root of racism that runs through the disparities is the fact that people of color often don't trust the healthcare system because
Right,
there's a long history of reasons why we should not trust the healthcare
right,
system. So we have to work really hard. Healthcare professionals need to work really hard to show people that things have changed and that you can trust the healthcare system. I also think that it's really important to encourage uh, our patients and the people that we serve to become part of those clinical trials and other studies, so that we have more reason to trust the information that we're telling people and that we're sharing with people, and more reason to trust the treatments. Because if we're actually part of the studies and part of the information, um, then there's, I think, more reason to feel like we can be part of the system, and that the system is there to serve us,
right,
and not there to harm us or take advantage of us, which it's going to take a lot to tear down that perception of the healthcare system.
Okay,
well, that
next
Dr. Lisa.
question. Do you have any advice for finding Black healthcare/service providers, especially in the Pacific Northwest?
That's a really great question. And I wanted to ask Yolanda, does your NAACP chapter have any type of provider directory or,
Not
partnership with any professional associations or anything like that?
Not that I'm currently aware of. We used to have a healthcare committee, and
Okay.
it lasted for not very long. But I think it would be beneficial
Hmm.
to definitely partner with some local Black healthcare professionals, and
What I
even if it's over into Portland. So
Right. What I always tell people to do, and what I've done myself, is start with your health insurance. If you do have health insurance, call the member services number that's on the back of your card and tell them what type of provider you're looking for, and they should be able to help you find that. Another
mhm.
way that you can search for different types of providers is using certain tools, like there's something called ZocDoc. I think probably most people have heard of. That is helpful because it usually shows a picture of the provider.
Oh,
Um, but the
awesome.
but the thing is, not providers are not mandated to share their demographic information.
Mm,
In some health insurance plans, you as a patient are mandated to share your demographic information, but the providers are not required to share that information. So it can be hard to find that.
mm.
Another resource that I've looked up providers is something called healthgrades.com. Not only can you, if they are sharing their demographic information, not only can you find that, but you can find out a lot about their background, like where did they go to school, what are their subspecialties, any publications they've done, and what the patient reviews are. From people that have used their services. So there are some things, but there's not any, 100% source of truth out there because, like I say, providers don't have to share their demographic information.
People in this webinar, how do they share this with others? What would be the best way?
Oh, I see. Okay. Well, I think the things that you've learned, like this is being recorded. So a lot of the websites that I talked about where you can get health information, and a lot of the other things that we discussed, you can share this with other people. You can share the recording with other people. You can talk about what you learned with other people. I think it's really important to let people know the main take home point, which is we can empower ourselves to take control of our own health.
Yes,
And that starts with the things that are on the slide that's up now, asking questions when you go to the doctor, taking notes, making sure that you are connected with a doctor you feel comfortable with, um, and taking advantage of the resources that are available.
that's awesome. Let me see some.
Also, one of the things that we mentioned earlier in the discussion is making sure that your family knows about your medical history.
Yes, that is vitally important. Because you may be in a situation or condition where you may cannot communicate that information.
Mhm.
And so that information needs to be easily accessible, readily available, and because you'll get in these stressful times and you're looking for the information and you think it's there, but no, your health starts with you. And that's what I wanted to convey tonight. And I want to thank you again, Dr. Lisa, for coming and just being this beautiful and wonderful representation to our communities. It is an honor having you here tonight. And I hope, no, I don't hope, I know that we delivered in our promise of making this information accessible to not just our local NAACP members, but to the communities at large out there. So, with that, everyone, I want to thank everyone for coming, and hopefully, we'll see you again. But this was our very first ever health equity webinar in Zoom. And this is only the beginning. There's a lot of information out there, but I think right now, more than ever, we need to be advocates of our own health, as Dr. Lisa said over and over again. And we need to not only empower ourselves, but empower those around us, right? We need to make sure, like the one person just said, that we don't have this information readily available, but that other people have access to it. So with that, Dr. Lisa, thank you so much, Roy and Melissa, for working behind the scenes. And Dr. Lisa, I will see you soon. And Roy and Melissa, thank you so much. So all of you.
Thank you, Yolanda. This was great.
Dr. Lisa, do you have anything else you'd like to say?
I just wanted to say thank you so much for the opportunity to be here. It was truly an honor. I enjoyed so much our discussion. And like I said, it's really energizing for me to be able to talk with someone like you who's knowledgeable and shares the passion that I have for
Oh, thank
health
you.
equity. I think it's so important, and I think it's amazing that you put this together and that you're getting this information out to our community. So thank you so much. This was a lot of fun, and I'm so happy we were able to do this.
Yes, I'm thankful, I'm grateful. And again, you can't tell, but I'm jumping out of my chair. This has been a long time coming, and our dialogue back and forth, I think it really resonated with the audience. It's good for them to see someone in the clinical realm, and at the same time a regular civilian, a regular person who goes to the doctor and check in, and to hear us deliberate and go back and forth. And I want that for our members in our communities. They need to feel comfortable when going to the doctor. And all of those points that you highlighted about, these are the things that can empower you to be in the doctor's office. Take a friend, take your phone. I would have never thought to do those things. Ask questions. Feel free to change your provider or your doctor if you don't feel like it's a comfortable, welcoming environment.
Right.
You know, and I think us not knowing also gives up our power. And you had a slide that resonated with me about that too. But no, you being here and taking your time and just your wisdom to give to our communities who need this information, I think is beautiful. And we can only grow from what we've done tonight. So thank you so much.
Thank you. Have a good night.